everybody. So, for our second topic, we're going to talk about a healthy lifestyle. And what that means is we're going to talk about some general guidelines for diet and exercise, and then talk about why this is important and how it can help reduce your risk for a lot of common health problems that we often see in Canada. Before we get started with this topic, take a minute to reflect on this question. What does being healthy mean to you? It means something different for everybody, and there's no right or wrong answer. So just pause the video and think about this for a moment, and then share it with the class if you like, or put it in the chat, or just think to yourself. This picture is from Canada's Food Guide, and it shows what kind of food should make up most of your plate. So, according to this food guide, half of your plate should contain vegetables and fruits. So, this can be any vegetables and fruits, such as broccoli, carrots, berries, spinach, tomatoes, bell peppers, apples, any fruits or vegetables. Another quarter of the plate should contain protein foods. So, that's any meat or chicken, fish, nuts or seeds, eggs, tofu, or beans. And finally, the remaining quarter should contain whole grain foods, such as whole grain bread, pasta, and brown rice. Finally, it's important to drink plenty of water. So make water your drink of choice more often than sweet drinks such as pop or juice. Eating healthy is not just about what you eat, but also about how often you eat. So in order to keep your digestive system functioning properly and make sure that you don't feel hungry, the Canada Food Guide usually recommends 3 meals a day and a light snack in between meals if you're feeling hungry. Also limiting sweet foods, but this does not mean that you should deprive yourself. It's okay to eat some snacks or candy, sodas, pizza, anything that you like, as long as you don't eat this all the time and you're making sure to also get good nutritious foods. Everything in moderation means some of the time is okay. In addition to limiting the amount of sweet foods and junk food you eat, it's important to get more fiber. Fiber comes from fruits, vegetables, and whole grains and helps to manage blood sugar levels and lower your risk of heart disease, and it's also good for digestive function. It's also important to limit your salt intake, which also leads to an increase in blood pressure and can lead to heart disease over time. So a way to limit your salt is to use herbs and spices instead when you're cooking, and to limit the amount of canned, processed, and packaged foods you eat. Women also have some additional dietary needs, especially iron. Low intake of dietary iron is common in women because women need more iron to make up for the amount they lose during their menstrual period. So you can get iron by eating red meat, chicken, and fish, legumes and nuts, and leafy green vegetables such as broccoli or spinach. In addition, during menstruation, pregnancy, and breastfeeding, and as well during menopause, your body needs more nutrition to make up for the amount of energy that you're spending, so it is important to be more conscious with your nutrition during these periods. So in addition to helping us just feel better in general, and to reducing the risk of developing health conditions later on in life, a good nutritional diet can help our immune systems and our body respond well to infections, including the coronavirus. So when we eat a healthy, balanced meal, our body is healthier in general, and that helps us fight off infections. The people that are at highest risk of COVID-19 are those who are older and with medical conditions that weaken their immune system. So although eating a nutritious diet is not a guarantee that you won't contract COVID-19, it does help your bodies just be healthier in general, and you have a better chance of fighting off the infection if you're exposed to it. Here's a pop quiz. The question is, true or false? There are specific foods or nutrients I could eat, in addition to eating a healthy diet, to prevent COVID-19. So pause the video for a second to think about this, and we'll talk about the answer in the next slide. So if you answered false, you are correct. There are no specific foods that will help protect you against COVID-19. Instead, just eating a healthy diet along with practicing other healthy behaviors strengthens your immune system and your ability to fight off infections. Some of these other healthy behaviors that would help keep you healthy in general are good sleeping habits, taking care of your mental health, and increasing physical activity, which we will discuss next in this presentation. So we're going to talk a little bit about exercise now. So just like having a guideline for healthy eating, Canada has physical activity guidelines as well. So according to these guidelines, adults should get about 150 minutes of medium to high intensity physical activity per week. This equals about 20 minutes per day. And that means anything that just increases your heart rate for a period of about 20 minutes. So some examples of medium intensity exercise might be brisk walking or bike riding. And examples of high intensity exercises would be jogging or stair climbing. The guidelines also recommend that you do some kind of strength training, like weight training, to make your muscles stronger about twice per week. When finding a way to increase exercise, it's important to choose the right kind of exercise for you. Gym memberships can be expensive and are not really necessary unless you have a certain goal in mind. And also, buying home exercise equipment such as weights can be expensive too, and there are alternatives you can use at home, like such as filling a jug with milk or water to lift weights, or going up and down the stairs, or playing with the kids. Anything that gets your heart pumping and lungs working is good physical activity. There are also many free apps available for your phone or free YouTube videos that provide all sorts of exercise routines, and they're available for any fitness level. Sometimes exercising with a buddy as well can make it more fun and help you stay motivated. And sometimes we just don't have extra time to exercise in our busy lives, but maybe you can choose alternatives. If you live close to work, for example, you could walk to work or bike, or choose to take the stairs instead of the elevator, or even parking your car at the far end of the parking lot and walking further to the door can be good. Really, any extra physical activity is healthy. So, in addition to eating healthy and increasing physical activity, reducing alcohol consumption can also improve your overall health. Increased alcohol consumption can cause health conditions such as high blood pressure and stroke, anxiety and depression, liver disease, digestive problems, and eventually, over time, brain injury and even cancer. So, this does not mean that you should not have a beer or a glass of wine or a cocktail when you'd like one, but drinking excessively can increase your risk for poor health. What does drinking excessively mean? Well, Canada has guidelines for alcohol consumption as well. And for women, these guidelines state that you should not drink more than 2 drinks per day or more than 10 drinks per week if you are a woman. For men, you should not drink more than 3 drinks per day or 15 drinks per week at the maximum. Smoking tobacco is another thing that can cause poor health outcomes and increase the risk of health conditions later on. This includes heart disease as well, high blood pressure and stroke, lung diseases like asthma, and cancers of the lung, bladder, breast, mouth, throat, and esophagus. So here's a video about the effects of tobacco use in smoking. And there's a link on the slide here in blue where it says here for some tips if you are interested in quitting smoking. It provides some information.
This animation will show the effects of smoking on the body. Click the navigation arrows below the animation screen to play, pause, rewind, or fast forward the animation. This animation contains sound. When you inhale smoke, it travels down your trachea and bronchi to your lungs. The bronchi branch and narrow into tubes called bronchioles. The bronchioles continue to branch and end with tiny air sacs called alveoli. When you smoke, over time, tar settles in your lungs and damages your alveoli. This makes your alveoli less stretchy, making it harder for your lungs to take in the oxygen you need. This can make you short of breath and feel tired. Smoking for a long time can lead to chronic obstructive pulmonary disease, or COPD for short. This term describes long-term conditions that affect the lungs, such as chronic bronchitis and emphysema, which cause breathing difficulties. Smoking can also have an effect on your heart. Carbon monoxide found in cigarette smoke binds to hemoglobin, a substance found in red blood cells that carries oxygen around your body. This prevents your cells from carrying a full load of oxygen around your body, making it harder to breathe and putting stress on your heart. Smoking damages your blood vessels, which affects how well your blood, and therefore oxygen, flows around your body. This makes your heart work harder and faster. Over the years, smoking causes fat deposits in your blood to build up on the walls of your arteries. This forms a plaque, which narrows and blocks blood vessels. This can lead to heart disease, stroke, and even a heart attack. If you smoke, you're more likely to store fat around your waist rather than around your hips. This is linked to a higher risk of developing type 2 diabetes, high blood pressure, and heart disease. Smoking affects your appearance. It can prematurely age your skin by between 10 and 20 years. Smoking stains your fingers and teeth. It also affects your sense of taste and smell. Smoking can also cause many types of cancer, including throat, mouth, lung, stomach, kidney, and bladder. Lung cancer is the cancer most commonly associated with smoking. This is the end of the animation. Click on the animation screen to watch it again.
So, why is a healthy lifestyle important, and why have we decided to talk about diet and exercise? Last week, you asked us about some specific health conditions, such as diabetes, and we decided to talk about lifestyle because these conditions that I've listed on this slide are all linked to lifestyle factors, by which we mean the food that we eat, how much exercise we get, and habits such as drinking alcohol and smoking. Additionally, often the symptoms and further complications of these conditions can be managed by modifying lifestyle factors to make healthier choices. So, by having a healthy lifestyle, we not only reduce our risk of developing these conditions, but also are better able to manage our health if we already have these conditions. So, for example, high blood pressure, which we call hypertension, is probably one of the most common health conditions that we see. This is when the blood pressure in your arteries rises and your heart has to work harder than normal to pump blood. There are many causes of high blood pressure, but one of the main ones is eating a high amount of sodium or salt, as well as fats like cholesterol, which then collect in the walls of your blood vessels and cause the space to be narrowed. Alcohol is also associated with high blood pressure. So, if you have high blood pressure, this is also linked to all of these other problems and can lead to the development of heart disease and stroke because your heart has to work harder. So, it's important to note that all of these health conditions are more difficult to manage once they have developed. So, preventing them from developing is key to health. So, on this slide, each of the titles in blue is a link to more information about each of these health conditions. We would have loved to cover each one in detail, but if you would like to learn more, you can click the links, and these are websites that have some good information that we've looked at and we think would be helpful. So you had also asked us a few questions about women's health, and I've listed these here again for more information. All of these titles are links in blue. But unlike the health conditions from the previous slide, these are not necessarily linked to diet and exercise. You can't prevent them by living a healthy lifestyle. However, having a healthy lifestyle, such as eating nutritiously and getting enough physical activity, can help reduce the symptoms and complications. So, for example, osteoporosis, which is the first thing listed here, is a disease where your bones lose mass over time, which can then lead to an increased risk of breaking bones. It affects women after menopause, mostly, and although it's difficult to prevent, by getting adequate calcium in your diet, so drinking milk or having yogurt and cheese, this can help prevent the risk of fractures by helping build your bones back up. And this can also help with things like arthritis and other joint pain. Menopause is a normal process in a woman's life and is different from every individual. But some have more severe symptoms than others, and there can also be an increased risk of changes in your body like high blood pressure and increased body fat and cholesterol. So, eating healthy and staying active also helps to relieve some of these symptoms and reduce the risk for developing poor health during menopause. For hormonal disorders, this can happen to anyone, women or men, and they cannot be prevented by lifestyle factors either. But diet can help to manage some symptoms. For example, thyroid conditions are linked to diet and affect how the body absorbs nutrition. So, getting a good nutrition can help manage the symptoms of this. And again, you can learn more by clicking on the link. And I just wanted to quickly mention endometriosis because there was a question asked about that as well. This link will include some more information. The truth is, doctors don't really know what causes it, and we're still learning a lot about this condition. So, it's usually treated with hormones or birth control or just symptom management because the main symptom of endometriosis is pain. So, I've left a link so that you can learn a little bit more about this. So, if you remember in our first video where we talked about when to call 811 versus 911, this is just a quick reminder. So you can always call 811 when you have a non-emergency issue, and you'll be connected to a registered nurse who can provide advice and tell you best where to go. If you have an emergency, you can call 911 and talk to an operator who will send an ambulance to your house. Or if you are able and well enough, you can go directly to an emergency room or an urgent care center. It's important to remember that if you are looking for information online, only to look at reliable sources. So websites like Alberta Health Services or Health Canada. And here I've included a link called Health A to Z that is produced by My Health Alberta, and it has information about many different health conditions that you might want to learn about. It is a very good website, so you can click this link if you'd like to learn more about anything. So this is the end of our presentation about healthy lifestyle. If you have any more questions, please let us know, and we will be talking about mental health in the next slide. Thank you again for listening.